Hi Julie, hi everyone. I can see the recording started.
Yes, hi Jim. We're
Probably need
back
to give
at
it a minute
1
or two,
o'clock.
won't we? Yeah, we
Uh,
might need to give it a minute to see if anyone else
okay,
joins, or do you want to? Let's give it another 60 seconds and then we can
okay,
see how we get
okay.
on.
Will do.
Well, I can see somebody's got their hand up. Nav, did you want to say something?
Apologies, I did it by accident. Thanks, Jim.
It's all right. You responded. Thank you.
Shall we start?
Let's start, Julie. Yeah.
Okay.
People can catch up on a recording, can't they?
Yeah, and there's lots of things to share this afternoon. So welcome everybody to our Better Together event. This replaces our usual annual members meeting. I just want to give a few, I'm Julie Holder, Chair of DCHS, just a few housekeeping rules there. So if you can, keep your microphone on mute, well, please keep your microphone on mute unless you're invited to contribute. Please don't feel we're being rude because we might mute you if you are actually keeping your microphone on. Turn your camera on and you're welcome to post any questions in the chat at any time. We are going to try and respond as we go through, but anything that we are not able to pick up or there are so many questions that we run out of time, we'll address at the end or afterwards. There will be a little bit of time for live questions. As Jim just said, we'll be recording today's event and posting it on YouTube with subtitles, and should you need it, the live transcript and captions are available to support accessibility. So, welcome. A couple of slides from me. Today's a really fantastic opportunity to hear and celebrate just some of the achievements. We're not able to talk about everything, and I have the privilege at the beginning of this meeting or this event to actually start with a few words which just reflect on my year. So I think as I look through, almost every one of my chair's reports has started with those words. So much has happened and at such rapid pace, and it certainly has been a year of considerable change in DCHS, the system, nationally, and we know globally as well. And I just wanted to mention a few things. This event is called Better Together, and I must begin with the importance of working with the system partners, which really does bring us closer together. Central to the changes in the last 12 months has been the ICB, Integrated Care Board reset, where there have been plans for all ICBs to cut up to 50% of their costs, and those plans were submitted in May of this year. This was followed by the NHS 10-year plan in July, and both of these national announcements support the move to actually lead to closer working within the Department of Health and Social Care, and they clarify accountabilities within the NHS and begin to realise the ambition of integrated working at the level of neighbourhoods. In response to this, our own Joined Up Care Derbyshire Provider Collaborative, which I have the privilege of chairing, reaffirmed commitment to work in the collaborative space and deliver better services and financial savings. A realistic programme of work has been agreed and is being worked through, although we know it is tough. In addition to support greater collaborative working, we have having separate meetings with each of our partners to discuss opportunities for working closer together. The 10-year plan highlights the need for creativity and transformation to ensure the sustainability of the NHS and make positive steps to bring care closer to home. However, what we must not forget, and this has been crucial for us as a board over the last 12 months, is that we ensure that there is a supportive environment for colleagues during times of change. It's very clear that the role of community services in the wider NHS is recognised as being critical. But we need to work even better and even closer with our partners and listen to our patients, our loved ones and our own staff in order to develop better services which achieve better value. That shift from acute to community, which we'll hear more about from Jim and others during the next hour, emphasise the vital role of community services in the NHS. And one of the things that is absolutely vital is the shift around prevention. And that's about creating gateways with things such as education. And this will continue to address health inequalities and build the future NHS workforce. Seeing the care all of you deliver day in, day out, firsthand, continues to be the absolute highlight of my role. I've had the privilege of visiting some of our teams over the past year, all of whom are doing amazing work with commitment, dedication, passion and compassion. It's always uplifting when we can see how progress is being made in delivering real benefits to patients. In the past year, I've had the privilege of actually visiting a number of teams, and I'm just going to mention a few. It's not an inclusive list. But yesterday we actually were opening Walton Hospital's new CDC, which was a fantastic opportunity to reflect on what working better together actually can achieve. I also visited Cavendish Hospital, Wheatbridge Sexual Health Team, Ilkeston Hospital Catering Team, Dales Wound Care Service, the Paediatric Surgery Team at Ilkeston, the Hospital to Home team at Royal Derby and public health nurses working at Ormiston Academy. I could spend a lot of time reflecting on what I've seen and how enjoyable those visits have been. There have also been multiple examples of recognition for excellence with Quality Award Always Gold and DCHS Dignity 2 awards. As a board, though, we also continue to talk about the importance of ensuring a sense of belonging and ensuring that we uphold our DCHS values by walking the walk every day that we are actually within the trust and outside. We know that delivering effective services with compassion is best done by engaging with our workforce. And it's hugely important to us as a board that during this time of change and need for greater productivity, we continue to live to our values. At our Inclusion and Belonging Conference, there was a continued focus on being kind to each other. And with our network chairs meetings, we have discussed unrest in communities and the importance of supporting colleagues during very challenging times. The principles of acceptance, honesty, forgiveness, communication, trust, respect, and conflict resolution are essential for both personal and professional relationships. And these are the underlying principles which will enable us to improve the health and well-being of people in Derby and Derbyshire. There's a focus on the need for change. We keep talking about this with an emphasis on making positive steps to bring care closer to home. And what I'd like to do at this point is to extend a special thank you to each and every one of you that work within DCHS and also within our system, of course. As I've said many times, some decisions may not be easy, but we must work together to make sure they're the right ones. I am absolutely hugely proud of continuing to be the chair of DCHS. And that's all you'll hear from me this afternoon, because I'm going to hand over to Jim now. Thank you very much.
Thank you, Julie. Good afternoon, everyone. My name's Jim Austin. I'm the Chief Executive at DCHS, and this is my 361st day in that role. So 4 more days and I get to my anniversary. And it has been a huge privilege to take up the reins of that role. And what we're going to dwell on over the next 45 minutes or so is a look back over some of the key areas that we have delivered against our four key pillars that we have within the trust and within our strategy. And those pillars, and you'll see them, I'll explain them as we go through them, are around people at the centre, about healthy communities, about working in partnership, and about focusing on the future. And we're going to try and just narrow ourselves down to the kind of financial reporting year that takes us out at around April earlier this year. So we'll look back at that. Now, as Julie's mentioned, we're a fabulously complex trust doing many different things. And I'm conscious that while we'll call out some amazing things, there will be some people who will feel, why weren't we mentioned? Why weren't we thanked? And you know, Julie's ended with a thank you there. I'm going to start with a thank you and end with a thank you, but I'll start with a thank you saying, if we don't acknowledge you, the work that you are all attending to is amazing work in very tough times. So let me get into these kind of slides to take us into, and it's not just going to be me, we're going to hear from a few people as well. Thanks, Tom. So let's start with people at the centre. And this is a number that always blows me away. So we've got 4,662 people who work within DCHS. And when you tot it up, that's 75,000 years of experience of combined service that we have within the trust. And I did a Google this morning to look at what was going on in the world 75,000 years ago. And you know, it was Stone Age. People were using bone and stone to do things, and you know, farming hadn't been invented. The immense experience that we have, when I compare it to my limited 11 years of experience in the NHS, is phenomenal. And I thank you for that service. It gives an average service length of around 16.5 years. So some of you will be sitting there going, I'm new into the trust. Gosh, that's a lot. And some of you will be seeing, we have people who've got more than 40 years experience with the trust and some with 50 years, looking back and saying, gosh, that's a huge contribution you've made. Of those 4,662, we are one of the top trusts in the country for staff engagement, not only with the very high score that you can see there, where 74% recommend DCHS as a place to work and 84% recommending care, but actually when you look at the participation rates, which is almost as important as the score, we have a very high uptake of those surveys. And it's important to me that people have their voice heard to and listened to. So when we do these surveys, we do a pulse check every quarter and an annual survey. Really important that you participate. We've got the highest staff flu vaccination uptake in Joined Up Care Derbyshire, and we are being tasked this year to improve that even more. And you'll hear that through our communications, and our staff flu vaccination programme starts in earnest in a couple of weeks' time. Really, the vaccination opportunity that we have in the NHS, I found out that it's £16 to go and get a flu vaccination through the private sector. This is money that we should all be taking up, and it helps you, it helps our families, and it helps the patients that we attend to and the citizens we attend to. So very proud that we're a high flu vaccination uptake trust. I want us to be even better. We've talked a little bit about staff recognition. The Rose and Iris Awards have been going along, and we also do our long service celebrations. We try and highlight this through our communications, and I'm very pleased to read all the nominations that come through and see the outcomes from those. Where we can recognise either people who've been recognised through patients and external bodies saying this is somebody I'd like to recognise, or internal recognition as well. Julie touched briefly on the continued focus we have on inclusivity, belonging and culture, and we have some really active staff networks covering the protected characteristics that some of us have. And many of us will have more than one. And the annual conference that we draw together people to discuss and see how we can do things better. It is really important, and we're going to move in a second to healthy communities, that we reflect and represent the communities that we serve, and that we look after each other really well. And all this is delivered on the backdrop of significant financial challenge. And in the last financial year, we delivered over £11.5 million worth of cost efficiencies. We're on track for an even more significant efficiency that we have to deliver this year, and it's hard work, I know that. And most of our costs in DCHS is people costs. It's the employment costs that we have, and that means that in order to deliver those efficiencies, we have to work differently. And I'm very grateful for the work and attention that people have given us there. Just move on to the next slide, please, Don. So I'm going to move into healthy communities now. So the Derby and Derbyshire footprint that we're a part of, it's just over 1 million people. depends on how you count it. And again, if we look at this, we have just under, so 1,819,000 appointments or patient contacts that we have, nearly 2 million contacts a year. A significant proportion of those are community nursing appointments, and our community therapy appointments, 161,000, are very, very significant as well. Our urgent treatment centres, and we support 4 of them around the county, saw over 95,000 patients last year. And this year we're on track for over 115,000, a significant uplift. And part of that is because of the challenges and changes we've been through as we tried to protect the staff and the patients through those services last year. But it is an area of very hot attendance. The urgent treatment attendances that we get are measured against the National Emergency Department 4-hour standard, and we are still seeing 96% of people within 4 hours, and that is phenomenal. When you look at the work, the nurse-led services that we have there, occasionally supported by GPs that we bring in, but it is a phenomenally hard-working service. I'm very grateful for the work they do there. It's also worth pointing out that we do a little bit with local hospices. We made a donation last year of just over £2,000. That was on the back of the vaccination programme, actually. So we were doing a matching process with the hospices. And through the citizens' advice work that we commission, we spend a little bit of money asking citizens' advice to come in and help and be referrals, not only for staff, but particularly for patients and service users. Citizens' advice have helped deliver £750,000 of unclaimed benefits, largely for our patients, and that makes a material difference, particularly in this cost of living challenge that we are living in at the moment. I'm very grateful for that work. Dom, can we go on to the next one, please? So Julie's mentioned a bit about the partnership working that we have, and it depends on how you count the sites that we deliver out of, but for this presentation, we're talking about over 60 sites where we work with system partners to deliver services. A lot of them we own or run, and we have a fantastic estates and facilities management team and grounds and gardens team who support all those. And Julie's just mentioned we were in the formal opening of the Chesterfield facility at Walton Hospital, Community Diagnostic Centre there. Beautiful prefab building that's going to be extended a bit further. And we deliver these services as close to people's homes as we can. And I think that is where we'll start to see, and I'll get into in a bit for the future, where we are beginning to recognise the value of the local services that we can deliver. The community diagnostic centres have cost over £30 million over the period of the delivery of the last 2 or 3 years. And there's a bit more to do. As I said, at Chesterfield, very successful implementation of some of the services in Whitworth a year or so ago, and Ilkeston, I went down to that opening back in February this year, again supported by University Hospitals Derby and Burton. And the kind of services those community diagnostic centres can offer are audiology, CT scans, MRI scans, phlebotomy, echocardiograms, DEXA scans, not all of them in all of them, but those are the kind of things that not only are the acute colleagues referring people into, but GPs and in the future some of our services will refer into as well. And that shortens the need for people, and it's the prevention bit really, to get in an early treatment where you can then prevent the exacerbation of a disease. I think that it's around 100,000 additional interventions that these community diagnostic centres will make for the citizens of Derby and Derbyshire, which is a huge amount of capacity coming there. And then at the bottom left of this slide, Community First, and Dom Fackler is going to be talking a little bit more about this, and we've got a bit of video on the Community First scheme. We launched that in Derby. 169 colleagues came across from Derby City Council, and we'll also start to signal in this presentation a little bit about the way forward, about where that might go for the county. Next slide, please, Dom. And then I'm going to talk, we'll bring this back at the end about future focus. We've clearly got a lot on at the moment. Bottom left, reduced carbon emissions, a 75% reduction in our carbon emissions based against the 1990 baseline is a phenomenal achievement. We've still got some way to go. Our green plan is still a very aggressive plan. We want to get better at that. But with all the new buildings I've talked about, mentioning on this slide, there's Belper's new health centre. We install solar panels. We do various various measures to help us with our carbon emissions and with our ecological footprint to make things significantly better. And while we are challenged with running some very old buildings, some of them Victorian, we do a great job at trying to minimise the carbon impact that we have. So Belpers are coming on stream in 2026. The New Home Health Centre opened for business during the course of the last year. A significant investment in there. It's a bit more to do with the cart house for those that have been down. There's still a needle in our side, but some great work going on with bringing the buildings up to speed and getting at the best possible health facilities that we can. Just on the top right here, it talks about Microsoft Copilot AI. So many of us are using artificial intelligence to help us with some of the work that we're doing. We're still in the foothills of that at the NHS to develop that in a safe way. But we are beginning to see the dawn and glimmer of some really exciting different ways of working. And I come back to a bit earlier, I talked about the vast majority of the spend that we have as a trust is on people. We have a significant number of people who work in our administration teams who support us to deliver services, the clinical services that we do. And we will be working very closely with them on how we can develop them to be masters of the technology that we want to get into. And that will mean a different way of working and a focus of the future. We will change the way that our patients interact with us. That will mean different administration tasks needing to be done. And we want to support people to provide them with the skills to do that. And then finally, bottom right here, we talk about the Community Transformation Programme, which I'm going to come back to a bit later on in the future. So I'm going to leave that one for now. Dom, just go on to the next slide, please. I'm going to set a bit of national context. So 10-year plan was published not that long ago, certainly not in the reporting period that we're talking about, but in September 2024, in the year that we're reviewing, Lord Darzi did his second report. So he did one about 10 years ago, and he concluded the NHS was in a critical condition and there were 3 core shifts needed to turn things around. Julie's mentioned some of these, but I'm going to reinforce them. I'm going to come back to them again a bit later on in the presentation. So analog to digital, we've got to use technology to modernize our services to boost efficiency. We're doing a bit of that with AI. We're very well served with our digital electronic patient record, TPP across the whole of the trust, except for sexual health services where we use a different one, but still very digitally led. So we need to move from treatment to prevention. And a lot of the work that we do, if I think about our school nursing, I think about our health visiting, I think about some of the therapy work that we do, we're moving into that space where we're trying to get upstream. A lot of the speech and language therapies work that we do with children is to try and get into that prevention piece to help us avoid the need for treatment in later life. And then acute community, clearly this is bread and butter to us. The Community Transformation Programme, I'm sitting down with the acute hospital chief executives directly after this call to take them through what we're doing in the community to help us be ready to receive and to support our acute colleagues, certainly over the course of this winter and into the future, where we can only do in a hospital what only a hospital needs to do. And at the moment, we do a lot of work in our hospitals that could be done differently and elsewhere. So there's some work to do in that space. So as a trust, we've laid some clear foundations for the 10-year health plan that came out about a couple of 3 months ago. And we're going to hear a little bit about how some of the services in Derby City have had a clear focus on prevention and shifting care from acute to community settings. So that's the next bit. And I think I'm handing over to Dom, I think. Not you, Dom Bradshaw, who's flicked us on, but to Dom Fackler. So Dom, I'm handing over to you, I think.
Thanks, Jim. Thanks, everyone. For those who don't know me, my name is Dom Fackler, and I am Head of Community First in Derby City. And I think we've got a little bit of time to talk about our service and what Better Together means for us and how we've kind of applied it and some of the benefits that we get from working better together with system partners. So our Better Together, very precisely, is with Derby City Council, and just building on the themes that Jim was just talking about that transition between the acute and the community. We've worked for a long time with Derby City Council as system partners about how we support seeing people in their own home and keeping them out of hospital. Our part in that process is often about supporting people following discharge from hospital and providing health and social care. And if we can in the community, it's about providing an urgent community response, and if we can, prevent them from being admitted in the first place. Following that initial intervention, we also think about the subsequent long-term health and social care needs and the care planning and what we can do to support them to maintain the level they're at and hopefully prevent their condition or their position from worsening in the future, to prevent them needing that acute level care again. So it's very much tied into the strategies that Jim's been discussing. So our Better Together is a partnership with Derby City Council, and as I've said, for a long time we've worked with them very collaboratively. Great relationships, good system partners. We've tried to develop and kind of get our services to work as closely as they can for a long period of time. And when I say our services, I'm specifically talking about, from a DCHS perspective, our community OTs, physios, nurses, a team of support workers who provide care in people's homes following discharge, care coordinators, admin staff. And we work very closely with the City Council and their teams who work in a similar arena, which are their hospital to home social work team, who Julie referenced, you visited earlier in the year, Perth House, which is a short-term residential home in Derby City, and again, a team of reablement support workers who provide care in people's own homes. So through working collaboratively, we made a lot of progress over a lot of years, but we felt that while we remained separate teams in separate organisations, there's a limit to how far we could take that progress. An obvious example of that would be that both organisations had a team of support workers delivering very similar, not identical, but very, very similar care to people in similar circumstances. And in times of pressure in winter, or other times of the year where we were under a lot of pressure, historically we found it very hard, due to different policies and procedures or different recording systems, to really maximise how those two services can work together. So in a partnership with Derby City Council last May, so May 2024, as Jim has already mentioned, we transferred 169 staff from Derby City Council into DCHS. So we're really proud to say that we now have an integrated service in Derby City, Community First, which is an integrated health and adult social care function. So we provide all those services that I've just listed, including the social workers, including the residential home, the reablement support workers and everybody else. So we're going through a lot of work about how we bring those teams together. An obvious example of an improvement that we'll get from that will be aligning the policies and procedures for the support workers that see people in their own home, putting them all in one electronic system, digitalising that service, and then we'll be able to maximise the capacity of that team, see more people, help bring people out of hospital earlier and keep them at home by providing better long-term assessments for them. So at that point, I'm going to stop talking, I think, and I'm going to hand over to a video which should have two managers. It should have Jane, who's a social worker who transferred across from Derby City Council and is a manager for her service. And it should have a Serena, who's a physio by background, who worked for DCHS for years and is now a manager, giving their perspectives about how we are working together and the journey that we've been on.
So as a service, we tend to support people to prevent hospital admission, and we also promote independence and return to independence when they come out of hospital. It's been quite an interesting journey for all of us, because it's bringing together what we already did as two separate teams, the Home First team, which was Derby City Council, and DCHS Rapid Response. So it's building those two teams and bringing them together. And it's been a real change in culture within our service to think about strengths-based assessments and how we put that person at the centre of our care in a social care way as well as a health way. So thinking about the next steps, we're bringing the two services together on Pathway 1, which is people in their own homes coming out of hospital. So that's a big lot of work that we're doing on the digital integration. So using a shared care record, using documenting on System 1, which we're hoping will go ahead for the 1st of October. And also it's really nice in that respect that we're bringing in the social care element as well. The social workers have access to System 1, and then they will be able to document on the same system and see that documentation, so we can have a really nice joined up care as well.
I think social work does add value to community health services. I think we bring a different perspective, whereas our health colleagues predominantly focus on the person's health needs and recovery. I think we look at the bigger picture. We focus on that person's social needs, their economic needs, housing. We look at their culture. We try to overcome barriers that prevent people accessing resources. We work to safeguard those customers. We make sure that people have equitable access to resources. So together with our health partners, we work holistically with the person and their family to improve their health outcomes and improve their well-being and their quality of life. Our experience of moving into DCHS has been very positive. We felt very valued. We've had visits from the executive team to meet with my team. I think DCHS have made great efforts as well to actually find out what it is that we do, because social work is one of those roles that is actually a little bit of an unknown quantity. The staff team found the transfer with talking about salaries and terms and conditions, that was seamless. My team are making really good use of training opportunities. 3 members of the team are already enrolled or have completed management courses, and we're now in the very early stages of looking at a social work apprentice route. The Hospital to Homes team primary focus is always to reduce length of stay, both within the acute hospital and within all pathways. We are assisting with the implementation of community transfer hubs. We are working with our Community First partners to improve the Pathway 1 offer, and we are now really starting to embed and look at how we can enhance our role with admission avoidance and the front door.
So as a service, we tend to support people to...
Thanks. I think we went back to the start there of the video. I'm not sure we need to watch it twice, but it was a great... what I like about that is that the 2 members of the team really closely linked to the services, really closely linked to the staff who are involved in the transfer, and they can really articulately put forwards the benefits and some of the real kind of benefits of bringing the 2 system partners together, DCHS and Derby City Council. I'm just going to finish by reiterating that in this circumstance, this is an ongoing partnership with the council, so it isn't something that we've taken away from them. We now deliver the services such as Jane's team on the council's behalf within this integrated function, but there's an ongoing commitment from both system partners to keep coming together to revisit and review this, to make sure that the council and DCHS are both working together to deliver the strategic aims of that partnership. So we haven't taken something away from the council. We're delivering services on their behalf under a very structured partnership. So I think that probably sums up where we are, and I'll hand back over to Jim.
Thanks, Dom, and do pass on my thanks to Serena and Jane. Fantastic little video that they've done there. And just to reinforce what Dom said there, this is around working in partnership. This isn't. This is absolutely about colleagues coming together for the benefits of the citizens that we're serving, to improve things for them, and as a result of that, we can do things more effectively and more efficiently. It actually very neatly segues into the work that we are in the foothills with, although we've been a long time in the foothills with Derbyshire County Council, and I'm hoping that Kirsty's on the call. I think I've seen her there, and I think I'm going to hand over to you, Kirsty, to talk about the work we're doing with Derbyshire County Council.
Thanks, Jim. I'm assuming everyone can hear me okay, unless I see any. Yeah, I've got a thumbs up. So yes, thanks for that. And it is a fantastic segue. So I'm Kirsty McMillan. My title is Director of Integration, and I joined DCHS as part of that partnership that Dom was describing. So I was involved heavily in that arrangement. So it's quite nice for me to be able to be talking about the next phase of our partnership in this context around working better together. together. So building on, but certainly not replacing the Community First partnership you've just been hearing about, we've got a new integration partnership being forged between the Trust and also Derbyshire County Council, which is obviously a bigger local authority with a bigger footprint. And in a similar vein, we are collaborating on the work that we do collectively, so our collective pathways, primarily focusing on short-term assessment, rehabilitation, and enabling individuals to reach their goals. We've got an overall ambition where we want to unify the services that we describe as intermediate care. So we want to see that more streamlined in terms of our ways of working. And ideally, we'd have a single service model that, as you were hearing in the video for Community First, still recognises our different professional skills and the contributions that both health and social care can bring to working with an individual. What we're hoping to do is use both of those strengths to achieve a more timely and effective set of outcomes for local people. So that's really the focus of all of this, is working better together will actually improve how effective we can be for local citizens. We're not doing this in isolation, so we have actually got across Joined Up Care Derbyshire a discharge improvement strategy, because a lot of the interface between health and social care involves either transferring between organisations, and that's quite acute in relation to hospital discharge, but it's not the only area. But the discharge strategy that we've currently got actually talks about doing everything we can to unify the different pathways that we've had historically. So it's in that context really that these partnerships with our local authority partners are being forged. And the plan ultimately is to integrate health and social care so that jointly we can enable as many people as possible to live and remain in the place that they call home. So that's our ultimate aim, is trying to manage that as best as we can. So rather than just hearing from me, it's also really important that you hear from people who are more operationally close to the services. So I'm hoping that a video will start working, which will show Jane Warder, who is one of the Trust Divisional Directors, and her counterpart Gemma Poulter and Lisa Holford, who are both directors in the County Council, and they'll be able to, like I said, give their perspectives in terms of the work that's going on.
It's a really exciting time for us at the moment in adult social care for Derbyshire County Council and for DCHS, because we're working collaboratively to understand where it will be beneficial to integrate services locally that will improve outcomes for local people, reduce costs for individuals, improve our collective sustainability as a health and social care system, as well as improving our multidisciplinary assessment and support services. So this includes discharge to assess pathways, bedded care and support, home-based enablement services, as well as our urgent community response.
The vision that's most likely to shape first is that to get to a single unified bedded care offer between the health and social care services, and that will support the discharge flow of patients and the step-up opportunities for patients. And that will involve the 6 wards that DCHS run. So that is Fenton at Buxton, it is Ochre at Whitworth, it is Alton at Clay Cross, it is Oakova Ward at St Oswald's in Ashbourne, Butterley Ward, which is at Ripley, and finally Hena Ward at Ilkeston. So those 6 wards, and the 3 community support bed sites that County Council run, which is Thomas Fields in Buxton, Staveley in Chesterfield, and Benley in Ilkeston. So getting that to one single unified offer. There'll also be a team of social assessment and social care practitioners, and all of that is coming together in the thinking, so that work is likely to proceed first. It is likely that the leadership model for this will be coming from DCHS, and that's because of the wider multi-professional groups that were in there with nursing, therapists, social work. So that's what the thinking is at the moment that we're planning through. But that could lead to key and interesting new roles, such as a lead for social care within the organisation, in order to enable this and move into a space where we're doing both health and social care as something new and excited and united together.
Although DCHS will be the lead provider for these services, this will be a joint responsibility for the partnership. So that's across both organisations within DCHS and also Adult Social Care in DCC. This is in terms of the governance of the services and also the performance in ensuring that we deliver the right outcomes for people. Adult Social Care bring with us strong relationships with the private, voluntary and independent sector and an ethos for strength-based practice, as well as our delivery of statutory duties and our experience of working within the legal framework. This will be embedded as well as social work leadership into the partnership with support from our principal social worker.
I'm going to say thanks to the video. I don't know why I'm saying thanks to the video, but back to me. That was just really a flavour from others other than myself about how excited we are about doing this. And just to finish off, it's useful to note that this is the beginning of a journey in terms of the partnership with the County Council. So we are going to be including some of the trust services, similarly to the ones in the city, but also including some of our community response teams, which we don't necessarily have in the city. But ultimately, this is the beginning of a journey. And earlier in the year, the Council's Cabinet and the Trust Board did agree that we should go forward with this formal partnership agreement. And we're currently in the process of looking at what the funding arrangements might need to be, how that leadership model that Jane mentioned would work. And ultimately, we will describe all of this in a legal framework. But at the moment, we're still trying to plot the path to that partnership. But as Jim said, you know, we're certainly off the starting blocks, and we've been working between the Trust and the Council at the frontline service for many years. So this is just taking it to the next level. And of course, we are watching and learning from Community First, because actually anything that we can do that has already been trialled and tested is fantastic. But there will also be differences as well. So this is really just a flavour. I'll hand back to Jim, and I'm sure in future sessions like this we can bring updates as they develop.
Brilliant. Thank you, Kirsty, and thank you to the team there. And to give you a sense of scale, Dom talked about 169 colleagues that are now from Derby City Council now working within DCHS. The Derbyshire County Council opportunity and scale is probably 4 or 5 times the size of that. And that's why some things are completely relatable and some things we're going to have to do a bit of rethinking around. I'm going to move on to Fit for the Future. We could flick on. So thanks, Dom. On to the next slide, which is a repeat of a slide that I showed a bit earlier, which I'm going to dwell on literally for 30 seconds. So just bear in mind the kind of the 3 DARSI core shifts: analog to digital, treatment prevention, acute to community. We've just done quite a bit on prevention and community. And what this all got linked into, that was published in July 2025, was the 10-year plan. Next slide, please, Dom. And we'll put into the chat a link. If you haven't seen it, it's 146 pages, I think, of joy to read. But actually, it's a very ambitious roadmap, taking about, and the strapline that Wes Streeting, the Secretary of State for Health and Social Care, used was taking the best of the NHS to the rest of the NHS. It really is a vision of what we want to get to around those 3 themes. When you start looking at what we have been doing in DCHS over the last 10 years, and more particularly over the last 5 years, it is completely on message as where the national direction of travel is wanting to go. And the best example of that is Team Up Derbyshire, highlighted within the 10-year plan as one of the great areas of success. Clearly people like Ian Lawrence and others have had a massive contribution into getting that off the ground. That the way that multidisciplinary teams, not just from DCHS, work together to attend to that need has been fantastic. Next slide, please, Dom. So to help us with this programme of work, we are also delivering a community transformation programme like the likes of which we have not seen in Derbyshire before. It's a multi-million-pound programme requiring the coordination and work across acute, across community, across mental health, across social care and beyond, to change the way that we do some of the work. And while the Community First work and the work that Kirsty's talked about are examples of how we're bringing that to life, the Community Transformation Programme is focusing on 3 core areas to deliver things quite quickly. We're talking about helping people spend more nights in their own home rather than acute hospital beds, improving discharge pathways and process of people whose needs are more complex, and increasing access to services which help people to recover their independence at home. And you can see the work that Dom is delivering and that team are delivering in Derby is in line with that. Next slide, please, Dom. So this 10-year plan also goes into some detail about new neighbourhood models of care, which brings health and wellbeing support closer to where people live. We have already organised within Derbyshire our systems to be around neighbourhoods. We didn't call them neighbourhoods, we called them local places. But in a moment, I'm going to ask Dom to play a video from Dr. Penny Blackwell, who is a GP and is leading on the thinking of how we can implement neighbourhoods. I sit alongside her with a colleague from the ICB to make sure that we in Derbyshire Community Health Services are also lined up in the thinking, but also in the way we organise ourselves to deliver the neighbourhood models of care. So Dom, could you play the next video, please?
Hello DCHS colleagues, my name is Penny Blackwell. I'm a GP here at Hannisbrook Medical Centre in Worksworth, which is where I'm filming today, and I am also the Clinical Director for Neighbourhood Health and Care in Derby and Derbyshire. DCHS as an organisation and its people have been absolutely integral to the transformation of community services that has been happening and is continuing to happen and to flourish in Derby and Derbyshire. One of the things that we are most proud of is our Team Up teams, and they are certainly really crediting DCHS in the leadership of our Team Up teams, particularly Ian Lawrence, who's devised these from the beginning, and increasingly Lindsay Frederick as well. So the leadership of Team Up teams in our community transformation has been led almost solely by DCHS colleagues, so thank you for that. And the shop floor, the delivery of Team Up teams has been really resourced heavily by DCHS teams, teaming up and working together. The success of these services has shown huge reductions in length of stay, reductions in admissions, but really importantly empowering people to make decisions. So that's not only people who we may want to admit from the community, but also the people who live and work in the geography of Derby and Derbyshire. And that DCHS teamwork as a multidisciplinary team for the local citizens has shown how DCHS is really organisationally really effective, but has aligned itself internally to the geographical populations of Derby and Derbyshire. And I would say it's the only organisation that's really done that. DCHS is also providing a huge amount of data and data resource to help us know how we're doing, and that can be really important in us being able to demonstrate that neighbourhood working is a success. So that can be anything from avoiding admissions through emergency departments, but also the data around falls avoidance. I'm a good example of that. I've been the Clinical Director of the South Dales, PCN, and one of your DCHS colleagues, she is an ASW, an advanced support worker, has been working with one of our pharmacy team to go and visit people who are at risk of falls and not pick them up after their first fall, but absolutely prevent that first fall, which reduces confidence and reduces longevity for somebody to be able to stay in their own home as well. So really crucial service, and you've been a really key part of that, and we would hope to grow that across the whole of Derby and Derbyshire. So I guess I would say a big thank you to DCHS for aligning itself and really getting stuck into neighbourhood working and leading and delivering a lot of this. What I would say most crucially for me is that DCHS colleagues have been driving the culture change that we've needed for neighbourhood transformation, and being that change yourselves and then encouraging others in the relationships, in the distributed leadership that it takes to lead in this way and to team up. So thank you DCHS colleagues, love working with you, and certainly really look forward to what we can all do together for the future.
Thanks. That's great to hear from Penny Blackwell, who's a real enthusiast for the work that we've been undertaking. We've got about 10 minutes left. I've got about 5 minutes to say something. And then if there are any questions, feel free to pop them in the chat, or we might have time for a live question by hand if you want. I just want to do, I'll move on to the next slide, please, Dom, a little bit of a look forward and a thank you. So we've heard a lot today about neighbourhood working, about being close to home, about some of the new facilities we're bringing on stream, about how we're working much more closely with our local authority colleagues, and how the partnership that we need to do, whether it's across acute, whether it's with local authority, whether it's with general practice, is probably the way forward that we will want to take things. And that is, in my view, absolutely certain. I am under no illusion that our greatest strength is our people, and the way that we will look after our residents, our patients, our citizens, to deliver the very best care is if we look after each other as well. And it is incredibly difficult to do that, given the pressure that we're under, the efficiencies that we have to make, and the decisions that we're sometimes being asked to make at pace quickly that aren't always the optimal decisions that we might want to make. So I want to say thank you for looking after each other. Julie talked about some of the pressures in other parts of the system where there are big programs of work to reduce the headcount numbers that we have to be very mindful of. And we ourselves are affected by that too in DCHS. And I want to acknowledge the support that we are giving each other throughout the trust. Every one of you matters, and the culture that we support, whether it's from the executive team or all the way through the trust, is absolutely essential to the way that we need to deliver our services. And it comes back to a feeling of belonging, a feeling and a demonstration of inclusivity and respect for each other. These are crucial things that we need to continue to reinforce and deliver. And we have done for a decade at least. I've been with the trust for 10 years. It's always been the way we do things around here. Change journeys are very rarely easy, but with the right culture and the right commitment, it will make a difference. We're better together working with partners, and it starts within our own culture. So I'd like to continue to reinforce the need to support each other and to celebrate together. So this is a journey. We're on the journey. I always talk about a rocket ship going to the moon and how do we get there? And we very rarely get there in one straight line. We will bounce around in order to get there. And it is by surrounding ourselves with people with very similar value sets to us and with an approach that we value each other that will get us there. The past year, and we've had some really exciting and interesting views about what we've achieved together over the last year, and what we've done with our partners has been very exciting. And like I say, 361 days into my role, I could not be more proud with the work that we have delivered, but I'm also conscious that there is a lot more to do. So I'm going to close just by saying thank you and just reflecting. We've heard a lot from different types of services. And as I said at the beginning, there will be people who are saying, we haven't talked about the thing that I do. And I am confident that the work we do, whether it is the catering teams in the kitchens, whether it's the domestics and the people working on our wards with our IFM teams, whether it's our estates colleagues, whether it's the people, organisational effectiveness team, our finance team, we are all working together. How could I forget our IMT digital teams? I mean, this is the trouble. Once you start listing, you're going to end up in trouble with somebody you don't mention. There is not anybody that I don't see when I go out on my daily visits to people who I don't see giving 100%, and I'm very grateful for that. So I'm going to close now my speaking. I haven't had a chance to look in the chat to see if there are any questions. Rob, come on in. What have you seen?
It was just to prompt you, Jim. We have got a question from Anna Watson, which is in the chat. Okay,
let me see if I can scroll up to where Anna's question is. Here we go. So I'm going to read it verbatim here. It says, do you think that the formal partnership agreement between health and social care, DCHS, will have access to some of DCC's buildings for our larger service team meetings, for example? I know this is a tiny issue compared to everything else, but it's discussed today. But there are cost implications to DCHS related to staff using their cars, time away from other duties. So I think that's exactly, and there's more in the question there. So thank you for the question, Anna. I think that's exactly where we want to get to. So we have something called One Public Estate, which means that all public buildings should be available to all partners within the system to use. We make our buildings available. So actually the meeting I'm having later on today is, it's not a DCHS meeting, it's a wider health meeting. We can do that. And right now, I know that if I wanted to have a meeting at County Hall in Matlock, I know that I could pick up the phone and probably get hold of a meeting space. There's a question there around costs and those kind of things, but the substance of your question is, yes, I'd want to share resources because we are all working in the public sector for the benefit of the residents, citizens, patients that we're attending to. So that's the intention, yes. And if you get a block, I'd be fascinated to hear about it. I'm certainly trying to work very hard with DCHS colleagues to open up our space so that others can use it as well. And that's a kind of trust and values thing, isn't it? We'd want to reciprocate. If we can demonstrate by doing, others will then follow and will let us into their spaces too. That's the only question that I think that's come through. I'm very happy if people have got, put your hand up now. Or Julie, I can see you're there and you're in my screen, you're the only one on my screen, which is lovely to see. I wonder if you might have a last 30-second, 40-second reflection on the meeting today and maybe close off the meeting. Would that be all right?
Yeah, that would be absolutely fine, Jim. It's been great to hear those examples. I think I just want to say as well, it's very easy to just list a few of the people that we've seen and some of the teams, and because they feature in reports or certainly in my reports. But all of the people that work within DCHS, I know that we as a board are extremely proud of, and everybody works every day to do their very best for the people that they actually meet and that they attend to, using your words, Jim. So just a massive thank you to everybody. I hope you realise just how heartfelt that is. So thank you.
Thank you, Julie. And I can see Lynn Walshall there, our lead governor. I should also put a shout out to our governors who help us to give some of the public voice to the work that we do as well. So thank you, everyone. We'll close the meeting there. Thank you very much.